In this video, we're going to talk about something that could save your life, recognizing the warning signs of blocked arteries. These signs might seem like small annoyances at first. Maybe you're feeling more tired than usual or having trouble catching your breath. But here's the thing, these could be signs that your arteries are becoming blocked, and that can lead to serious health problems like heart attacks or strokes. Every 36 seconds, someone in the US dies from cardiovascular disease. And the tragic part? Many of these deaths could have been prevented if the warning signs were noticed earlier. But too often, we dismiss these symptoms as just part of getting older. The good news is, if you recognize these warning signs early, you can take action and protect your heart. Before we start, I'd love to know, where are you watching from today? Just drop your state or city in the comments below. And if you have any natural health tips of your own, feel free to share those too. Someone else might really benefit from hearing what's worked for you. Point 1. Chest discomfort. Chest discomfort, or angina, is one of the most common early signs of blocked arteries. But here's the catch, it doesn't always feel like the chest-clutching pain we see in the movies. Instead, it may feel like pressure, tightness, or aching in your chest, especially when you're doing something physically demanding or feeling stressed. It might even radiate to your left arm, jaw, neck, or back. What's happening here is that your heart is struggling to get enough oxygen-rich blood because your coronary arteries are narrowing due to plaque buildup. This makes your heart work harder to pump blood, especially when you're exerting yourself, and that's when you feel discomfort. Many people brush off this feeling as just being tired or experiencing muscle strain, especially if it goes away after resting. But that's the danger, it could be your heart trying to signal that something is wrong. Research shows that angina is often the first sign of coronary artery disease, which puts you at a much higher risk of heart attacks. If you experience chest discomfort or tightness that comes and goes, especially with exertion, it's important to talk to a healthcare professional. Don't wait until it gets worse. Early detection and treatment can prevent a much more serious health crisis down the line. Point 2. Shortness of breath. Shortness of breath is another warning sign that many people overlook, especially as they age. But it's more than just getting winded after climbing stairs or doing light physical activities. If you find yourself feeling breathless during activities that didn't use to tire you out, or even while at rest, it's time to pay attention. When your arteries are blocked, your heart struggles to pump blood efficiently, which affects how oxygen reaches the rest of your body. Think of it like trying to water a garden with a hose that has a kink in it. The water, or oxygen, in this case, can't reach its destination effectively. To compensate, your body tries to get more oxygen by making you breathe faster and harder, which can feel like you just can't catch your breath. This symptom is especially common in women, who often experience shortness of breath as their primary sign of heart disease. In fact, research shows that women are more likely to report breathlessness instead of chest pain when they have heart problems. If you're feeling increasingly breathless or even struggling to breathe while sitting down, don't ignore it. It could be a sign that your heart is weakening because of blocked arteries, and it's important to seek medical attention. If this resonates with you, especially if it's happening during regular activities, don't wait, reach out to your doctor and get it checked. Early intervention can help protect your heart and overall health. Point 3. Dizziness, lightheadedness, or sudden nausea. If you've ever felt dizzy, lightheaded, or suddenly nauseous, it can be unsettling, especially when it happens without any clear reason. These symptoms often get overlooked or dismissed as a result of dehydration or stress, but they could actually be a sign of reduced blood flow to your brain or other vital organs due to blocked arteries. When your arteries become narrowed or blocked, your heart has to work harder to pump blood. If the heart can't pump efficiently, the blood flow to your brain is reduced, leading to dizziness or a feeling of lightheadedness. In some cases, this can even lead to nausea because your digestive system isn't receiving the blood flow it needs, which causes discomfort in your stomach. These symptoms tend to appear suddenly and can be frightening. While they might seem mild at first, especially if they pass quickly, it's crucial not to ignore them. If you experience these symptoms along with other signs like chest pain or breathlessness, it could indicate that you're at risk of a serious cardiovascular event, such as a stroke or heart attack. If you frequently experience dizziness or nausea without an obvious cause, or if these symptoms appear alongside other warning signs, make sure to seek medical attention. Addressing these signs early can prevent a potentially life-threatening situation. Point 4. Unexplained sweating, fatigue, or cold sweats. Unexplained sweating, especially cold sweats, can be a subtle but serious warning sign of blocked arteries. Unlike the sweat you might get from a workout or being in a hot environment, cold sweats happen when your body is under stress due to inadequate blood flow to vital organs. This can happen when your heart is struggling to pump blood effectively through narrowed arteries. Fatigue is another symptom that should never be ignored. We all feel tired from time to time, especially as we age. But if you're experiencing overwhelming exhaustion that doesn't improve with rest, it could be your heart signaling that it's working harder than usual. When your arteries are blocked, your heart has to work much harder to pump blood, leading to fatigue that affects your entire body. This kind of tiredness isn't just about needing a nap, it's a sign that something deeper is going on with your heart. Women are especially likely to experience fatigue as an early warning sign of heart disease, sometimes for weeks or even months before more obvious symptoms like chest pain appear. Cold sweats can also be an indicator of heart strain, often accompanied by feelings of anxiety or unease. If you're sweating excessively without physical activity or an obvious cause, it could be a sign that your body is under stress from insufficient blood flow. If you're feeling more fatigued than usual, sweating for no reason, or experiencing cold sweats, don't brush it off. These symptoms should prompt a visit to your healthcare provider for a thorough checkup, especially if they're happening regularly or in combination with other signs. Point 5. Pain that spreads beyond the chest. Chest pain or discomfort isn't always confined to just the chest. When your heart isn't getting enough blood due to blocked arteries, the pain can spread to other parts of your body, especially in your left arm, neck, jaw, back, or upper abdomen. This is a critical warning sign that many people dismiss, thinking it's just muscle strain or something less serious. When your coronary arteries narrow due to plaque buildup, your heart struggles to pump blood, and it can cause pain that radiates outward. This pain might not always be sharp, instead, it can feel like a dull ache, heaviness, or tightness, and it can last for several minutes or longer. Often, this pain occurs during physical activity, emotional stress, or after eating, when the heart needs more blood and oxygen, but the blocked arteries can't keep up with the demand. The pain can also spread to other areas, such as your back, which is often mistaken for muscle strain. It's important to recognize that this isn't just regular discomfort. This could be a sign of coronary artery disease, which can lead to a heart attack if left unchecked. If you experience this type of pain along with other symptoms like shortness of breath, dizziness, or nausea, you must seek medical attention immediately. Pain that radiates from your chest to other areas of your body is a strong indicator that you need to take action. Don't dismiss it as something minor. It could be a sign that your arteries are blocked, and your heart needs help. Point 6. Leg pain or cramping while walking. Leg pain or cramping that occurs while walking and disappears after resting is another major red flag when it comes to blocked arteries. This condition is known as intermittent claudication, and it occurs when the arteries in your legs become narrowed or blocked, preventing blood from flowing properly. It often starts as aching or cramping in your calves, but it can also affect your thighs, hips, or buttocks. When you walk, your leg muscles require more oxygen-rich blood to keep moving. However, when the arteries supplying your legs are blocked, the blood can't reach your muscles efficiently. This causes pain or cramping, especially after walking a certain distance. The pain will usually stop once you rest because your muscles no longer need as much oxygen. Many people dismiss leg cramping as a normal part of aging or poor fitness, but it's actually a serious symptom of peripheral artery disease, PAD, which can also indicate blockages in other areas of your body, including your heart and brain. PAD affects millions of people worldwide, and it's particularly common in those over 50, especially if they have a history of smoking, diabetes, or high blood pressure. If you experience leg pain that comes and goes with walking, it's essential to get it checked out. Blocked arteries in your legs are often linked to arterial blockages in other parts of your body, and early treatment can prevent more severe health issues, like a heart attack or stroke. Point 7. Non-healing foot or leg sores, coldness, or color changes. If you have persistent foot or leg sores that don't heal, or if you notice your legs or feet feel unusually cold or change color, it could be a sign that your blood flow is severely restricted due to blocked arteries. When your arteries are blocked, your extremities aren't receiving the oxygen-rich blood they need to heal properly. This lack of circulation can cause wounds or sores to linger for weeks or even months without improving. Non-healing sores are particularly concerning because they indicate that the tissues in your legs and feet aren't getting the blood supply necessary for proper healing. Additionally, if one leg or foot feels much colder than the other, it's a strong indication that the blood flow is compromised in that specific area. Changes in skin color, like paleness, a bluish tint, or a shiny appearance, can also signal poor circulation. This happens when blood is unable to reach the skin's surface, leaving it with a pale or even purple hue. The loss of hair on your legs and feet is another visible sign of reduced circulation. Hair follicles need good blood flow to grow hair, and when that flow is reduced, hair growth can slow down or stop entirely. If you notice these signs, don't wait. Seek medical help immediately. These symptoms are often associated with peripheral artery disease, PAD, which increases the risk of serious complications, including infections, gangrene, and even the need for amputation if left untreated. It's critical to act fast and get the blood flow restored before the damage becomes irreversible. Point 8. Erectile dysfunction in men. Erectile dysfunction, ED, isn't just an issue of intimacy, it can also be a warning sign of blocked arteries throughout the body. In fact, erectile dysfunction is often one of the first signs of poor cardiovascular health, especially when there's no clear psychological cause. The arteries that supply blood to the penis are smaller than those that feed the heart and brain, so they are often the first to show signs of blockage. When plaque builds up in the arteries, it restricts blood flow not only to the heart and brain but also to smaller blood vessels, including those in the pelvic region. Men who experience erectile dysfunction, particularly without an obvious psychological reason, are at a higher risk of developing heart disease, stroke, or other cardiovascular issues in the future. It's important to note that ED doesn't always occur because of stress or age. When it happens without any apparent cause, especially in men over 40, it's a serious red flag. Your arteries could be blocked, and this early sign gives you a valuable opportunity to address potential heart disease before it progresses. If you're dealing with erectile dysfunction, it's essential to have a conversation with your doctor. They can help identify whether it's related to arterial blockages and guide you toward the right treatment to address your heart health as well as your sexual health. Recognizing this connection early can help you protect your heart, improve circulation, and even prevent more severe cardiovascular problems down the line. Point 9. Transient ischemic attack, TIA, or stroke-like symptoms. A transient ischemic attack, TIA, also known as a mini-stroke, is a temporary disruption of blood flow to the brain. Although the symptoms may resolve within a few minutes or hours, TIAs are serious warning signs of impending strokes and should never be ignored. TIAs occur when a blockage in the arteries temporarily interrupts blood flow to the brain, causing symptoms similar to those of a stroke, such as numbness or weakness on one side of the face or body, difficulty speaking, or vision problems. Even though the symptoms may disappear quickly, a TIA is a major alert that your arteries are severely blocked, often in the carotid arteries that supply blood to the brain. The risk here is that a TIA significantly increases the chances of a full-blown stroke in the near future. In fact, research shows that about 1/3 of people who have a TIA will eventually experience a major stroke. Common symptoms of a TIA include sudden numbness or weakness in the face, arm, or leg, particularly on one side of the body. Difficulty speaking or understanding speech. Sudden vision problems, like loss of vision in one or both eyes. dizziness or trouble walking. If you experience any of these symptoms, even if they seem to go away on their own, it's crucial to seek immediate medical attention. TIAs may seem harmless at first, but they're often a precursor to a more serious and life-threatening stroke. Act quickly, and don't underestimate the importance of early intervention. Point 10. 6 Ps of acute limb ischemia. Acute limb ischemia is a serious medical emergency that happens when there is a sudden, complete blockage of blood flow to an arm or leg. This condition can lead to irreversible damage in a matter of hours and, if left untreated, may even require amputation. The 6 Ps, pain, pallor, paleness, pulselessness, paresthesia, tingling or numbness, paralysis, and poikilothermia, coolness, are the key signs that indicate acute limb ischemia. Here's what you need to look out for. Pain, severe, sudden pain that doesn't improve with rest. The pain may feel like a deep, burning sensation in the affected limb. Pallor, the limb becomes pale or white, often losing its normal color, which is a sign that the blood supply has been cut off. Pulselessness, if you can't feel the pulse in the affected limb, it's a strong indication that the blood flow is severely restricted. Paresthesia, tingling or numbness in the affected limb, caused by nerve tissue not getting enough oxygen. Paralysis, weakness or loss of motor function. This may start as difficulty moving the toes or fingers and can progress to the inability to move the limb at all. Poikilothermia, the limb feels cool to the touch because it is not receiving the necessary blood flow to maintain normal temperature. If you or someone you know experiences these symptoms, it is a true medical emergency. Immediate medical intervention is needed to restore blood flow and save the limb. The 6 Ps are a clear indicator that time is of the essence. The sooner the blood flow is restored, the better the chances of saving the limb and avoiding serious complications. Recognizing the warning signs of blocked arteries is crucial for protecting your health, especially as we get older. The 10 symptoms we've discussed today, from chest discomfort to leg cramping, shortness of breath, and even erectile dysfunction, might seem like minor inconveniences, but they could be your body's way of telling you that something much more serious is going on. The key is not to ignore these signs, no matter how small they seem. Early detection and intervention can make all the difference in preventing a heart attack, stroke, or even limb amputation. Your heart, brain, and overall health depend on you taking action now rather than waiting until it's too late. If you've noticed any of these symptoms or if they've been persistent, it's time to talk to a healthcare professional. The sooner you catch a problem, the easier it is to manage and prevent more serious consequences. Remember, your health is in your hands. Recognize the signs, take charge, and get the help you need to live a long, healthy life. Thank you for watching, and if this video was helpful, don't forget to like, share, and comment. Let us know which symptoms you've noticed, or share this video with someone who might benefit from these life-saving tips. And remember, stay tuned for more valuable health information, because your heart deserves the best care.